Good afternoon, everyone. So, today's class will be dealing with a topic, but it's continuation of the previous one. Like we had spoken about. Just a second. We discussed about Samiksha Bhava and Parihar Vishayas regarding to Panchakarma. So, in the same with the same context, let us discuss the significance. Why all those factors have to be assessed before we start with any Panchakarma procedure. It has wide range. Panchakarma, like it starts from Deepana Pachana and ends with Samsarjana Karma, right? Anything in between, like Vamana, Virechana, Nasya, or Shirodhar, whatever Panchakarma procedure we select in a patient, it depends on so many things, like whether the patient is indicated, whether the disease prevailing in that patient is indicated, and also whether the kala rutu which is prevailing at that moment when you are performing panchakarma, whether that rutu is conducive for that panchakarma procedure, and also whether the person or the patient in whom the disease is manifesting, whether he is residing in a place where Panchakarma can be advocated. So there are n number of factors which we have to take care, and in today's class we'll deal with few such factors. What is the significance of assessing those factors? Okay, so we'll come across this shloka repeatedly now. Samiksha dosha aushadha desha kala Satmya Agni Satvali Vayobalani. This is from Charaka Siddha, third chapter, where Charakacharya mentions we have to give Panchakarma after we assess dosha, aushadha, desha, kala, then Satmya, Agni, Sattva, Vayo, Vayas, and Bala of the patient. We have to assess these factors. This is just one reference. There are scattered references about what and all factors have to be assessed. The reference is very scattered in the classics, but the gist of all that is the shloka from Charaka Siddhi. Though this is applicable to Basti, but this can be applied to other Panchakarma procedures also. This is a basic rule. So the same can be applied to all Panchakarma or any procedure you undertake, like even with the Shalyakalma or Shastrakarma, the same applies, but in a different way. When we talk about Panchakarma, this is the basic rule. So what you have to assess, Charakacharya has given a basic rule. That is, it starts from dosha. We know that Sharira is made up of tridosha, and all others follow these doshas, right? It can be manas, it can be the prakriti of the person, whatever you take, everything is depending on this dosha. So, first we'll assess the dosha in a person, which dosha is manifesting, which is the pradhana dosha, which is the anubandha dosha, all that, and we come to a conclusion of what chikitsa has to be given in this patient. So, first basic factor we have to assess is what is the dosha prevailing, what is the dosha responsible for the manifestation of that disease. Second thing is aushadha. Now we have diagnosed the disease, and we are in a position where we clearly know what is the samprapti. Now it is our duty to see which aushadha is best for that uh, predominant dosha, or the for the samprapti vigatana, what aushadha is best. That is the second part, which is a completely which this selection of the dravya or selection of the panchakarma, that is completely based on the yukti of the vaidya. And also we have to have good textual knowledge for this aushadha prayoga, because same trivrit with different anupanas in different Rutu acts in a different way. And same Haritaki. If we go through Bhav Prakasha first chapter, Haritaki Adi Varga, Haritaki when used in different forms, that is Swinna Haritaki, if you do the mardhana of that or the make paste of it, or if you are giving Haritaki in different kala, with different anupana, it acts differently. So, Aushadha is completely with textual knowledge and yukti of a person he is going to use. So, we'll start with the third factor, that is Desha. Why assessing of Desha is important? First thing we get a reference is Ishta Deshe, Ishta Sarvopakaranam. When here Desha does not mean that it is a country or a state or a city, etc. Here, Desha can be taken as a place where the patient is there present, or also where we are conducting the Panchakarma, or else even the Deha Desha. We know the classification of Desha, right? Bhumi Desha and Deha Desha. So, here Desha is Ishta Desha. You are conducting Panchakarma in a place which is comfortable to the person. We know, like, we have a Panchakarma unit where we are giving medicine to a patient who is indicated for Virechana. Okay. So, for Virechana Dravya, you are giving in a place which has some unacceptable smell. We know that Dvishtartha Samyogaja Chardi is there, right? You are giving Virechana Yoga in a place where it, there is very unacceptable smell, and that Virechana Yoga gets vomited in no time. So the place should be very comfortable, Ishta Deshe. For the same reason, we have to assess the Desha also. Then there are few diseases where manifestation of disease is because of um, few ahara consumption, which is Desha Viruddha. For example, in Jangala Desha, if a patient goes on consuming all these ruksha, laghu, shita ahara, then the chances, the probability of getting vata vyadhi is very, very high. Correct. So, for that, one example is Kashipa refers telling that Amlapitta is more seen in Anupadesha, hence the treatment should be just like that of Jangaladesha. Okay, so for diagnosis of disease, for the treatment of disease, you should know about from where the patient is coming from, where he got this disease, where he is residing now, where he is getting the treatment, or and also whether the place where he is taking treatment is conducive to him, comfortable to him, whether there is something which is bothering him in that place. So all this comes under Desha. And also for collection of dravyas. We know uh, Shilajitu has to be collected from Parvata, right? We cannot get Shilajitu in coastal area. For the same reason, collection of drugs, we should have a knowledge of Desha properly. Shalmali is found in many places, but Shalmali from north and also from places where there is good rainfall, the Kantaka will be very good. So we should have good knowledge of Desha also from where the drugs have to be procured. And for diagnosis, of course, we know that filariasis is very common in coastal area, and hypothyroidism is common in very hilly area. For diagnosis, also, we should know a little bit about the place, and also from where the patient is coming, whether he has traveled, etc. To understand the diet pattern, whether I'm residing in this place, or whether I got transferred, I just relocated, whatever it is, there will be a typical diet pattern according to from where I belong, right? Uh, Patients who are from a particular region, whether they migrate, whether they shift or relocate, they'll follow a
typical customs according to their religion, according to their caste, according to their tradition, etc. We should know about that also, from where he comes. Patient from Gujarat, even if he is residing in Bangalore, he will follow a typical diet pattern according to his place of origin. We should know about that. And if I am here and I am treating a patient on telemedicine, we have that with telemedications right now. So I am treating a patient online. So I should know the weather of that place. For example, Virechana has to be given in Sharad Rutu, right? But I have a patient where the Virechana karma has to be done in a in another rutu, uh, depend like because of the condition, because of the disease. Then we have to create an atmosphere which is just like that of Sharad Rutu, or else we are conducting Vamana in some other Rutu. Then we have to create the atmosphere just like that of Vasanta Rutu. So for all this purpose, we should have proper knowledge of Desha. Okay. Then intake of particular food causes like, for example, in Andhra we see that most part of Andhra Pradesh they eat spicy food, right? So we have a patient who complains of urdhvagamla pitta, adhogamla pitta, parinama shula, or all such related to mahasrotas. Then we have to inquire about his place of origin, the type of food he consumes, if is there any change in the particular food pattern of because of some shift in his place or whatever it is. So that particular intake of food will be related to his place. And few diseases we see that it is because of unhygienic places like malaria, cholera, jaundice, dengue, etc. Uh, we can diagnose based on that. For example, if he is hailing from a place where the quality of water is not good, or he recently traveled, or he recently uh, hailed from a place which is known for malaria extra, we can diagnose, probably we can diagnose diseases. So for that also we should know about um, knowledge, we should have some knowledge about the desha. Then there are few places where organic farming is done now, but major part of our country they are using the chemical fertilizers, pesticides to grow food. So that also causes lots and lots of diseases nowadays, we know that. So um, we should know little bit of that, like what food is grown in that place, and what type of pesticides, because um, majorly liver is the one which gets affected by these chemical fertilizers, etc. And also few causes hormonal disruption also. So when we know if he is from agricultural field, or that he is his background is from agriculture, or he is working in some factory which uses pesticides, etc. If he is suffering from some bronchial asthma or some skin related allergies, or hypersensitivity reaction, etc., we should know about where he is from, that place where he is from. And of course, water and air pollution, because Makashwasa or all these Kasa, Rajayakshma, etc. Um, it's basically due to the quality of air, right? So we should know where that person is working and what is the quality of air. We know that I have a patient who is from Haryana. She because of the temperature, soaring temperature there, almost for 24 hours a day, she is using air conditioner. So quality of the air there is bad, and also prolonged use of AC is giving her lots of trouble with respiration. So we should know a little bit about that place, so that it becomes easy for us to treat. Uh, And the quality of air in Delhi is so very bad that cases of bronchial asthma, cases of all these allergic rhinitis, etc., is soaring high because of the level of pollution there. If you have a patient who is from Delhi and he complains of all these symptoms, we should know a little bit about quality of air in that place, right? So, because of these reasons, we should have it may not be in detail, but we should know a little bit about Desha. Uh, Maybe Bhumi Desha is what I'm talking now. Dehadesha, if you come, that itself is a big chapter, right? Dehadesha, it includes Prakriti, Sattva, Satmya, all that comes under Dehadesha. That is Ashtasthana Pariksha. All that comes under Dehadesha Pariksha. Here I am speaking about the Bhumi Desha, where we have to take care about the diet, the weather, the type of food they consume, the pollution level, etc. So, this is why we should know about the Desha. And if you are interested more to know about this, there is a reference in Kashyapa Samhita which is about Desha Satmiyadhyaya. You can go through that where he tells, according to Desha, he tells different types of mm, ahara, then different types of aushadha, etc. We can go through that. Then coming to the second, this is the fourth point actually. Dosha, Aushadha, Desha. We completed three, right? Now coming to Kala. We know Kalo hi Nama Bhagavan, right? Kala is nothing but Bhagavan himself, which is classified into Nityaga and Avastha. Nityaga is nothing but all our Rutu Vibhaga, then day and night, then seconds, minute, hour, all these come under Nityaga, right? Why should we know about this? Then also we have a classification called as avastika, which is basically related to disease. Which avastha the disease there, that is shed kriya kala, which dosha is in sanchaya, which is in prakopa avastha. All this come under avastika kala. Why we should have a basic knowledge about this kala. We know that um, all our aushadha, all the panchakarma procedure, the food, whatever consumption or dinacharya, rutucharya, you name anything, it is all based on kala. Okay, that is, we have panchakarma mentioned according to season. Basically, we know two panchakarmas which is classified according to um, season. One is Vamana Vasanta, right? We have many colleges which perform this Vamana Vasanta. That is, in um, patients who have repeated seasonal uh, diseases like Tamakashwasa or if Ketikba Kushta, etc. Those will be posted for Vamana during Vasanta Rutu, that is Chaitra Masa. Then who are having all these pittaja diseases which gets repeated uh, yearly depending on season, udarda, then visarpa, shita pitta, etc. We go for virechana during sharad rutu, right? So they also, a person who wants to just undergo rutu shodhana, vamana will be conducted during vasanta. There are many colleges they perform this vamana vasanta like camp. 10 to 15 patients will be given Snehapana, and then during Vasanta Rutu, they will be given Vamana, even for Swastha. So, we know this classification. And also, Varsha Rutu, we have Basti is indicated during Varsha Rutu. So, for that also, Kala Vibhaga, we should know which season, which Panchakarma is best. And Hemanta, etc. You can go for Abhyanga, Utsadana, etc. And also Ushna Sweda because the Rutu will be having too much of Shaityata. So that is important. Then coming to Snehana, that is Snehapana. We know that um, much of our Snehapana, like the dose fixation, or when to consume the food, and how long the snehapana should be given. All this depends on the kala, the dose. We decide the dose depending on when the sneha got digested, right? We ask the patient, at what time did you feel Shuddha Udgara? Because he'll be having Sneha Udgara. After consuming 30 ml of Snehapana at 7:30, he might have this Sneha Udgara till 12. Every time he gets that Udgara, there will be smell of Sneha, or else he can feel that, right? So once he gets Shuddha Udgara, we ask the patient to note the time, and then if he is feeling hungry, then he can consume this ganji. So um, that gives us the knowledge of how much Agni he has, and how much that Agni is capable of digesting the Sneha. Depending on when he felt hungry, the dose of next day will be decided today. That is very specific for Snehapana. And then, um, after how many days of Snehapana? For like Krura Koshta, we usually advise it for 7 days. For Madhyama Koshta, 5 days. For Mrudu Koshta, 3 days. Okay. So this is also Kala Vibhaga of the Snehapana. Then Svedana, usually we do it for 2 days. Then coming to Vamana, in Vasant Ritu we do. And Shleshma Kala, we know that early morning Vamana is conducted. And after giving Madana Yoga, we wait for 1 more. So here there are little bits of this information scattered on how important the Kala is. Time is in Panchakarma. That is, we have to wait for 1 Muhurta Kala. We have to give um, uh, this Vamana yoga, or Vamana has to be done in the early morning hours. You cannot perform Vamana in the afternoon or in the evening time, right? So, and in Swasta, Vasanta Ritu is best. In others, any season, but the condition should be created just like that of Vasanta Ritu in other Ritus. So this is how the importance of Kala is. And coming to Virechana, it is best done in Sharad Ritu, but Shleshma Vetrita Kala, that is, he should not feel too much of hungry, like uh, to give Virechana. Then we have like um, according to season in Virechana, Trivrit can be given in different ways. Like in Grishma Ritu, we can give Trivrit with honey. Trivrit with Sharkara. Then in Sharad Ritu, we can give Trivrit with Draksha and Yashtimadu. So that is also depending on the Kala. And Vamana, previous to Vamana, we give Kapha right? We go for at night, we ask the patient to take the Hivada, then anything which increase the etc. We to increase the kapha. But before Virechana, we advise the patient to take something which is laghu and ushna. Okay, pepper rasam usually advise, or soup, some lemon coriander soup, etc. So that is also depending on what procedure we are doing and when it has to be given. You cannot give this food during Snehapana or morning of Svedana. It has to be given previous day of Vamana and Virechana respectively. Then coming to Samsarjana Karma. Um, this Samsarjana Karma, how many days we have to do, and when it starts. After Shodhana, depending on the Vegiki, Maniki, etc. Lakshanas, we decide which type of Shuddhi it is, whether it is Pravara Shuddhi, Madhyama Shuddhi, or Avara Shuddhi. On that basis, we decide how much samsarjana has to be, how many days of samsarjana has to be given. For example, if it is pravarashuddhi, then 7 days of samsarjana is advised. If it is madhyama shuddhi, 5 days, and then if it is avarashuddhi, 3 days of samsarjana minimum has to be done in order to increase the agni and also to improve the bala of the patient. This has to be done. Okay. So next is basti. We know that basti is best advocated during Varsha Rutu, and for Anuvasana basti, it is after food. Like he has to consume food. After consumption of the food, he has to wash his hand. Before his hand dries, you have to administer Anuvasana basti. Niruha has to be given in empty stomach, and interval of 15 days have to be given between Vamana Virechana and basti. Then classification of yoga, kala, karma, bastis, depending on the number of days. Niruha and Anuvasana are given alternatively. Then Nasya, we know that in Pitta conditions, we have to give it in Madhyana Kala, and Vata in evening hours, and Kapha morning hours has to be selected. Uh, all this is telling you how important it is to consider time and also Ritu, and when like to bifurcate that whether it is indicated now or not. Uh, so this basic information about Kala has to be there in order to avoid so many complications. Okay, then we discussed about this Parihara Kala also, right? So this is about 2 points in that Samiksha Bhava. Desha, Aushadha, then Dosha, Aushadha, Dosha, Kala. These 4 points we discussed today. So in the next class, we'll be continuing with other points like uh, Samiksha, Dosha, Aushadha is done. Desha, Kala is done. We'll talk about Satmya, Agni, Sattva, Vaya, and Bala in the next class. So if you have any doubt, you can just let me know, or else in the next class we can discuss if you are not able to follow anything. Let's check if I have left out any points. Let's see, and we have for importance of Desha, I would like to add one more point. Uh, in Tamakashwasa patient who are residing in metropolitan cities who are not finding good relief with the medication, what we usually suggest is we ask them to relocate to coastal areas where they feel without medication they feel better. So we should know about this also, right? Where if the patient is feeling comfortable just by changing the place without much medications, etc., it's good. Um, if it is possible, and not that it is possible that in every patient of Makashwasa, but if it is possible, we can relocate also. And yeah, just like Panchakarma according to Rutu, we were mentioning, right? In this Grishma Rutu, we have to advise some Shitala Kriya like Shitadhara. Um, they go for all these spa treatments, right? So we can ask them to go for Jaladhara and then Shita Jala Avagaha in Grishma Rutu. So depending on Rutu, depending on the condition of the patient, we have to see which Panchakarma is suitable at that moment. Okay. So I think I have covered much of the point. So if you have any doubt, let me know in the next class. So I'll end it here. Yeah, thank you everyone.